let's do a little quick review. The number one axis is the section, and last night I told you guys the section is about the nature or the character of the procedure. Okay. Number two is the body system. Number three is the root operation. Root operation, we now know, is the final intent of the procedure. Number four is the body part. Five is the approach. Six is the device. And seven is a qualifier. Now, in the PCS, in the AHIMA exam, guys, I was told, and I've been observing, year by year, how they make their exams, how AHIMA determines the composition of the exam. I was told that there's not a lot of PCS questions like really in detail. There are PCS, PCS codes, but as to the guidelines, there's not a lot. But just the same, we're learning how to, how to assign PCS codes, right? So I'm not going to go into the really smallest detail of the guidelines, but what is important for you guys to understand is how these codes are built. The code structure, the building blocks of the procedure code. However, I'm not saying that it's not important to reread the guidelines, because we never know when it's gonna be useful, right? So I'm gonna go into some parts of the PCS coding guidelines that I thought are really important in the exam, in the AHIMA exam. What is important, guys, okay, is your basic knowledge of how to build the PCS code, right? That is very, very important. And I told you guys that last night that when you're starting to build your PCS code, it is important that you understand the root operation, okay? You can start from the root operation. Seasoned coders, like, experienced coders, we one look at the procedure, we already know how to build the code, right? I know how to build the code, even if I don't go to the root operation. But for starting coders like you guys, starting learning the PCS codes, it is important that you understand what the root operation is, okay? And I keep repeating this, root operation is very essential part of building your PCS code. Now, there are different root operations that are very common that hospitals perform, right? And last night we did a couple of examples of those common root operations. Number one that is very common is resection. Okay, resection. You need to understand what is resection and the difference between resection and excision. These are most common. What else? A most common root operation is bypass, right? And we'll go into details of this in a little bit. What else? Dilation. And I will explain to you, there are many more, right? Last night we looked at alteration, what alteration means. We look at inspection, right? Insertion, we talked about the last night. But let's talk about this four here that I thought very common hospitals perform on a daily basis, okay? So resection, if we go to the book, guys, everybody please go to the book and let's go to 838 again. And let's try to decipher what truly is the meaning of resection in terms of root operation, okay? And root operation is the third axis, right? That's your root operation. Okay, so 838, if I go look at resection, this is what resection definition actually means. Let me read. Okay. Resection is cutting out or off without replacement all of a body part, okay? Cutting out or off without replacement all of a body part. That's what resection means. So every time you guys see the prefix, earlier I told you guys, when you see this, doctor documents ectomy. that is, um, you know, put in a body part or appended in a body part, like mastectomy. Mastectomy means removal of the breast. Prostatectomy, it is surgical removal of the prostate, right? What else? Hysterectomy, okay, removal of the uterus. Every time you see that ectomy at the end of an organ, this is your root operation. With the exception of lumpectomy. Sometimes doctors use this a lot, right? Lumpectomy. So lumpectomy is basically just surgical removal of the lump. It's not the entire organ, right? It's not the entire body part. But doctors use this word. I mean, many times. Vasectomy, yes. So that part of of the male reproductive organ is completely removed. So that's what I meant about this ectomy is resection. All right. Now, the excision, like what I have explained to you guys last night, excision is also a surgical procedure which aims to only cut out a small tissue, just a small piece of the body part, mostly for diagnostic purpose, for biopsy, right? If the doctor decided to perform a bronchoscopy and also at the same time collect a small tissue of the lung, then that is excision. So the difference, guys, in the AHIMA exam, they always ask this question: how do you differentiate resection from excision? May not be a direct question like that, but they will give you scenarios. Okay, and you are to decide whether this is excision or whether this is resection. Okay, so these are very common: resection, excision. Okay, what else? Bypass procedure. Bypass is, of course, very often done because people who experienced myocardial infarction, right? And it's one of the most common procedures performed on the daily basis, right? The daily basis. So a bypass procedure is very common, and I'm going to show you guys tonight, how to do bypass procedure, whether coronary bypass or gastric bypass. There is a way to code. It's not the same as what we have learned from last night. It's a different way to code it, but just the same, guys. Like I said, you need to understand uh, completely what the doctor means when the doctor, does his documentation. Okay. Another root operation that's common is dilation. Dilation is when the doctor decides to enlarge the dimension or a tubular body part. Usually, it's also performed when the patient's having um a bypass, a myocardial infarction, and from looking at the patient's angiogram, the doctor was able to determine the area where the narrowing of artery is happening, right? And there was a clot there. Sometimes the doctor does not need to perform the bypass procedure. We'll just do a dilation. We'll dilate the artery in order for the blood to continue to flow through. So that's another common procedure. What else? Another common procedure would be replacement. Okay, joint replacement, right? If the doctor performs a joint replacement, right? So that's a common procedure. Replacing. Let's read what root operation replacement is. It says here, replacement is putting in or on biological or synthetic material that physically takes the place and or function of all or a portion of a body part. So joint replacement, your root operation obviously is replacement. All right. Another common procedure that I can think of is reposition. Look at reposition, guys. Reposition. Let's read. Reposition is moving to its normal location or other suitable location, all or a portion of a body part. Now, why is this common? It is the root operation when a doctor, an orthopedic surgeon, fixes a fracture, right? So when the doctor fixes a fracture, the doctor is repositioning the displaced bone, right? To return it back to its original anatomical position. That's what reposition means. So it's very common because fractures happen here and there. Patient had an accident, had a broken bone or two. Reposition is also a common procedure. Okay. So there are many of these root operations, guys, and I really strongly suggest, go to this part of the book, Appendix B. It starts with 838, and read these common root operations. Okay, so that when you're building your code, you already have a good understanding of where to start. Any questions so far? Yeah. Okay, so I think it's clear enough, right? That how to use the book. You already know how to use the book. Let's now talk about this procedure, guys. I said, Andre, I was referring to 838. Those are your root operation page. Okay, 838, and it goes all the way to 840. Okay, 840. So 838 to 840. Read those common procedures, right? Excision, resection, reposition, replacement, removal. Those are insertion, inspection. So those are common root operations that you can start with when you're building your PCS code. Okay, now let's go to a procedure that's very common also, and let's see, guys, how this procedure is coded. We now know that when we build our code, right? You start with the root operation and then look at the body part, right? Let's try that once again. Okay, let's try that once again. Matter of fact, in the slide that I gave you guys last night, let's go to the slide again. I have some examples here. You see this, guys? Okay, let's try to build this code. Okay, let's try to build this code. I don't know if I have the answer, but yes, I have the answer here. But let's go try to build this code without looking at the answer, because I forwarded you guys. I sent you the slide, but let's try to build this without looking at the answers. Okay? Can you guys build the codes? Let's start with, what did I tell you about ectomy, sigmoidectomy? You start with the root operation resection. So let's do that, guys. Let's go to resection. I think it's on 108 from last night. Was it 108 or 110? Resection. And let's look at sigmoid. Your body part, guys, I have this instruction here, is sigmoid. Let's go look at sigmoid. If you don't see sigmoid, you start with colon. Resection of the sigmoid. I think it's in the colon. And this is this is also important, guys, to understand that having a strong knowledge of the anatomy will help you a lot. Okay, so I have this. I went to colon and then look at sigmoid, and tell me, guys, what 4 letters you see in the in the book. Okay, so Sherry says 0DSN. Okay, let me validate that. 0DSN. It is resection. Okay, so it looks like my code here. If you go to resection and then sigmoid, I'm getting a different one. I'm getting a different answer. Anyone? Do you guys agree with this 0DSN or something else? Carol says 0DTN. That's more likely, Carol. I think that's more. I mean, that's more appropriate than 0DSN. Let's write that down here in our board. Okay, so resection of sigmoid, open resection of sigmoid starts with 0DTN. Okay? Now, why do I know that this is the correct 4 letters? I know it's always 0. The surgical procedure always starts with 0. I know for sure that the body system, there's nothing else. There's no other value for the digestive or the gastrointestinal system but letter D. It is always represented by letter D. That's the permanent value for the gastro or the digestive system. And the resection, guys, the root operation resection always has a value of T. So even if if you're giving me an answer that's not that does not start with 0DT, then I already know that that's not the correct one. Now the body part, of course, they may differ. Now what we're going to do is let's go to 0DTN in our book, and let's build our code. Of course, the fifth character, because this is an open procedure, guys. Look, it is an open procedure. So what should be your fifth character? It's a no-brainer, right? If it's open, what is your fifth character value? Even if we're still looking for the code here, but we already know what the value for the fifth character, right? What is the value for an open approach? So Carol has the code 0DTN. Fifth character, because this is open, should be 0, no device, no qualifier. This is your complete code, right? Matter of fact, the next slide shows that 0DTN, 0ZZ, right? Do you guys find PCS coding more simple, right? I think it's more fun, right? Yes, thank you, Sherry. It's more fun to build the codes, right? Using their PCS book. Let's try the next slide, guys. Okay, the next slide is looking for this. Okay, 58-year-old female who was admitted with acute blood loss anemia had an elevated cancer antigen from her blood work. A transvaginal endoscopic excisional biopsy of the uterus was performed, and the collected tissue was sent to pathology to rule out uterine cancer. What is the correct PCS code? So you have all the tips here, guys. You have the body part, the uterus. You have the root operation excision. What is the approach? Transvaginal endoscopic. That is endoscopic via natural opening, right? And your qualifier, this is a biopsy. How are we going to code it? What is your root operation? Obviously, your root operation is this, excision. So let's go to excision. Everybody do that. Go to excision in your index, and let's go look for What is the body part? Uterus. Okay, excision and looking for uterus. All right. Excision, uterus. Tell me, guys, what are the first four characters? Zero UB9. Let me look at it. Zero UB9. Yes, so I agree. Do you guys agree with this? Carol gave us this code. The first four characters, 0UB9. Sherry agrees. Okay, what about the rest? Do you guys agree with the 0B9? I agree. Okay, Rody also agrees. Let's complete the code, guys. Let's go to 0B9. What is the approach? Approach is endoscopic via natural opening. Okay, we have Sherry here has 0UB9 4ZX. Let's try that. 4ZX. And let's look for the code, guys. Do you guys agree with this? Oh, it's actually 8. You mean the fifth character, right, Sherry? It's the fifth character. Okay, so 0B98ZX. Now, let me see if you guys agree with this code. I'm not going to look for the code because I'll explain to you guys one by one here, character by character, why I agree with this code. And you should agree with this code, okay? Even without looking at the book. Okay, so Leon agrees. Look, 0 is a permanent value for the surgical and medical. U is the body system for female reproductive organ. I mean, like, because there is a pattern, guys. You will be observant, look at the patterns. Letter B here is the value for excision. When your root operation is excision, the third character is always letter B. Okay? Let me repeat, if the root operation is excision, the third character is always B. That's why I know at least the first three characters is letter B. Now, the body part, which the book actually, when you look at the root operation and the body part, this was given 9. This is the uterus. The rest of the codes, 8ZX, I know they are correct, right? Because letter 8 here is the permanent value for an approach that is endoscopic via natural opening. The difference between 8 and 4, 4 is endoscopic percutaneous. If it's via natural opening or artificial opening, your value is number 8. And no device that was used, that's why our sixth character value is Z. We decided that the last character has to be X because this is biopsy in nature. You see, guys, it's actually more intuitive, right? But just looking at the codes, don't be scared with numbers with all these characters, because one look at the entirety of the PCS code, it's going to give you the idea of what characters or what root operation it is, or what is the nature of the procedure. When Sherry submitted the code like the last character is X, I know it's correct. Why? Because I know that this is diagnostic in nature and the last character has to be letter X. And in taking the test, guys, in the AHIMA exam, there are a lot of combination codes that look like this. And my advice is that don't be scared. You have to build your strategy, right? You have to embrace it, okay? Own what you know. Like, I know that the fifth character has to be, if not 0, 4 or 3 or 8. at least memorize those guys, and I'm very positive that you will do fine in the AHIMA exam if you guys at least work on your PCS codes. Okay.